Bathing and dressing with assistive devices. These videos are intended to help you be more independent in your activities of daily living. Any specific modifications of these activities based on your environment or your condition can be discussed with your therapist individually. Bathing with a long-handled sponge. Approach the tub and sit on the tub bench with good form. Scoot towards the center of the bench and place the uninjured leg in the tub first, and then using caution, lean backwards, supporting yourself with the arm to help lift the injured leg into the tub. Use the long-handled sponge to wash below the knee, keeping your knee and hip in good position. When done, lean back, supporting yourself with your arm, and help lift the injured leg out of the tub. Once again, scoot over to the edge of the bench, adjusting as needed, and then lift the uninjured leg over. Stand using good form and to strengthen your uninjured leg. Putting on socks using a sock aid. There are two typical types of sock aids: a firm, hard plastic one such as this, and a soft, flexible one such as this. They both have straps that you can hold on to toss it towards your foot. Scoot forward in the chair, keeping the leg in a good position. Scrunch up your sock and place the sock over the front of your sock aid. Make sure the sock is adjusted well so your foot can slide into it easily. Keep the upper cuff of the sock smooth towards the top of the sock aid and make sure the sock is scrunched up evenly. Using the straps, toss the sock and the sock aid out in front of the foot, keeping your leg in a good position. Pull on the straps of the sock aid to get it over the heel and up the back of the calf. You can use a reacher to adjust the sock as needed. It's recommended when dressing that you keep your reacher, your shoehorn, and your sock aid, as well as your pants, underwear, socks, and shoes in a reachable location. This procedure can be performed either with the firm plastic sock aid or the flexible sock aid such as this, and with short or long socks. This would be an example of a short sock. The procedure is the same, slipping the sock over the front of the foot and gently pulling it over the heel, making adjustments with the reacher as needed. Putting your underwear and pants on using a reacher. Since the procedure is the same for both underwear and pants, this video will serve as an example for both. Take your arm and thread it through your pants on the injured leg side, making a nice scrunched hole to grab with the reacher. Use the reacher to thread your injured leg through the pant leg. Adjust as needed to get the foot fully through, and then pull with the reacher to raise your pants up past your knee level so as to avoid reaching past your knee and compromising any precautions you may have. You can also use your reacher to bring your walker in close so as not to lean forward. If it's available, you'll always want to use a chair with arms on it to make it easier to get up and get down. Since we don't have arms, we'll lean to the side and use the strength in the good leg and the arm on the walker and a firm object with the other arm to push yourself to stand. Elastic waistband pants work the best as they have a decreased tendency to fall as you go to stand. Putting shoes on with a long-handled shoe horn. Slip-on shoes are the easiest to use after you have an injured leg. However, if you're using lace-up shoes, simply adjust the shoe to make it a little wider and then retie the shoe. Fold the tongue of the shoe over top the laces so as to get it out of the way. Use the reacher to place the shoe on the floor just on the outside of the foot. Adjust the shoe position as needed, and then place the long-handled shoe horn in the back of the shoe, sliding the front of the foot into the shoe using the shoe horn to guide the heel. Again, the reacher can be used to make any minor adjustments to the tongue of the shoe and or the shoe itself to make it comfortable. Take precaution that when placing the foot in the shoe, you lean back using the shoe horn so as not to bend too far at the hip. Once again, when it's time to stand, you can use your reacher to grab your walker. And if you have the option of using a chair with handles, that would be best. If not, use the strength in your arm and your uninjured leg to stand. Thank you for your time. These videos are typical examples of ways to use assistive devices so as you can be more independent in performance of your activities of daily living. Any specific needs that you may have or modifications that you need to make based on your condition or your environment can be discussed with your therapist. Thank you once again, and we wish you good luck with your recovery.